and welcome to RSNA 2021. My name is Brian Casey, Editor-in-Chief of AmpMini.com. So one of the big stories here at this year's RSNA has been artificial intelligence. It's been the hot topic at RSNA for the last number of years. We have with us Dr. Michael Atalay. He is a professor in the Department of Diagnostic Imaging at Brown University. And he's presenting a very interesting paper this week on Tuesday on whether AI is affecting the decisions of medical imaging of medical students to choose radiology as a specialty. Dr. Atalay, thanks for being with us today.
Thank you so much for the invitation. Brian, as you've seen and you commented on in the introduction, over the past few years, AI and other emerging technologies have really had a great impact at the RSNA, and it's reflective of the impact they're having in radiology in general. In fact, you can wander around the vendor halls here and just see how much of what is being sold now is focusing on artificial intelligence. And we recognize that in radiology, and we believe that for many of the things that we do on a routine basis, AI and other emerging technologies will help us. It'll serve as an assist device in the way that we practice and move forward and care for patients. But from an outside perspective, in particular from a medical student perspective, it may seem that we're ceding ground to AI, and in fact, AI may pose an imminent threat to our field. I think that's sort of a concern that a number of medical students we've talked with have had. And so we conducted a survey back in 2017 of all medical students at Brown University, really to kind of gauge the effect of emerging technologies on the way that they're thinking about residency decisions and career paths beyond that. And we looked at all the specialties in medicine, not just radiology. In fact, our survey was administered by a School of Medicine administrator, and it was agnostic to any specialty. So we weren't biasing them in any way towards radiology. So we did it in 2017, and then we repeated it again this past year. And we wanted to see if there were changes in these perceptions and how medical students at various different years had or were perceiving these emerging technologies. We asked questions in this very brief survey about what specialties medical students were considering, what the effect in the next 10 to 20 years of emerging technologies would be on these various specialties, and then what specialties they would not consider because of the risks of emerging technologies taking over their jobs.
And where did radiology stand in that list?
So radiology, cutting to the chase, fares the worst of all specialties. So we found that in 2017, 23% of medical students would not consider radiology because of the concerns levied by emerging technologies. In 2021, it was exactly 23% again, which I suppose you could look at in a positive fashion and say it's not increasing.
It's not getting worse.
It's not getting worse. We also found that those students who are interested in radiology also say that they're interested in radiation oncology, anesthesiology, and pathology. In fact, we could create cohorts by looking at how students said their interests sort of were aligned. And we defined the three dominant cohorts as surgical, pattern recognition or algorithm-based, in which radiology falls, and medical. And so in that cohort of specialties that radiology finds itself, it's diagnostic radiology, interventional radiology, pathology, anesthesiology, and radiation oncology.
Yeah.
And the other specialties, radiation oncology, anesthesiology, and pathology, also are considered more vulnerable because presumably the students recognize there's more algorithm-based pattern recognition, pathology slides. Dermatology just was underneath that in terms of its risk, and you can understand how that would be, fall in line, because dermatology, they're largely looking at skin lesions and trying to make diagnoses. And
Yeah.
so it's an interesting dilemma that we find ourselves in, because here we are embracing technology, and we in the world, actively engaged in radiology research, education, and clinical work, see this as helping us, and we want to embrace it, but we have to convey a message, sort of like embrace but not replace, and that's kind of the message that we have to share with medical students, that we have to disabuse them of the misperceptions, at least in our opinions, the misperceptions that radiology is vulnerable in a bad way, and in a way that's much more egregious than with other specialties.
Well, it's kind of a similar debate that happened within radiology when AI first came on the scene, where a lot of radiologists were like, "Oh my God, keep this away from us. This is going to replace us." And eventually that went away. But it sounds like the same debate is happening in among medical students.
That's right, and that's our pipeline. And I think that a common sentiment these days is that radiologists who use AI will replace radiologists who don't use AI.
I heard that, yeah.
And I think that the ACR has been very proactive in this realm, and they created the Data Science Institute. They have, you can go and look at the toolkit that they actually recognize. I think there are something like 140 different AI systems that they recognize on this toolkit at the ACR Data Science Institute website, and they're ahead of this. And it's important to democratize the AI systems, to make sure that they're vetted. And they also conducted a very interesting survey of ACR members, and I think that there were something like 1,800 respondents, and then don't quote me exactly, but something like 30% said that they actually use, or 25 or 30% actually use AI on a routine basis. I know that mammography was cited as an area, screening mammography, that was particularly benefiting. I think 9% of the respondents said that they used some screening mammography AI. Then there were PE detecting AI, and brain analytics, and brain hemorrhage.
Yep.
So it's trickling in. But I have to say, even though we've seen it here for, 5 years or something like that, it hasn't swept in as a wave. It really is. It's kind of is edging in.
Yeah.
But we see it. It's so prevalent
Yeah.
here.
Now, anything is there anything radiology can do to reach out to medical students to, as you said, disabuse them of that notion that AI is going to be taking radiologists' jobs in the near future?
I think that we have to come in early into medical school. Early meaning early in the first year of medical school curriculum. Not only showing what fantastic things that we do on a daily basis. And I remind residents and fellows that I sit alongside of, as we're reviewing studies and we're talking about artifacts and how this study quality is limited, I say, take a step back and just think about how amazing it is what we're able to do this.
Yeah.
We're peering inside the human body, seeing function and structure at sub-millimeter resolution, and it's mind-blowing, really. And I think it's an easy sell in that regard when you show people what you're able to do and how radiology is a central focus of so much of modern medicine. That's the easy sell. We have to, at that point, I think, say we are using tools and artificial intelligence, and we are finding great benefit in the way that we deliver care to our patients.
Yeah.
And that it's like having smart fellows and residents that are there,
right there, 24 hours a day. Yeah.
Right. They
Never
don't
get
slow
tired,
down.
don't need coffee.
That's exactly right. Exactly right. So I think for us doing this, the benefit we see as being vastly outweighing the negative. But that is the perception that we have to take care of with medical students, and it has to happen early before they start to be biased against radiology.
Yeah. Dr. Atalay, some great thoughts. Thanks so much for being with us today.
Oh, it's my great pleasure. Thank you.
Great. Signing off for AmpMini.com, my name is Brian Casey.